Hi, I'm Janky. I'm one of the clinical pharmacists based at ESH. We provide a service where we check all the drug charts and do the clinical checks on the drug charts. We will then supply medication for patients and prepare them for discharge. So this is where all the medication is prepared to be supplied to the wards. We make sure all the wards have enough drugs to give to patients when needed as well. You will find me on the wards asking you questions about the drug charts and what drugs you've written on there. So I might ask you about interactions and if you're happy for the patient to be on those two drugs, or if you want to change them, I might give you some advice on what we could change it to. So we'd work together on making those decisions to make our prescribing decisions safe for the patients. So you can also ask me questions or any of the other pharmacists about any concerns that you have or any decisions that you're not sure about. If we're not on the ward, then you can bleep us or you can contact us and we'll give you those numbers when you arrive. You can contact Medicines Information via the phone and they will deal with complex inquiries that you may have for your complex patients.
Hi, my name's Beth. I'm Lead Medicines Management Technician here at Eastbourne DGH. The team of technicians are ward-based, so we'll come up to the wards, we'll assess patients' medicines on admission, we'll undertake medication histories and do a medicines reconciliation. We'll talk to the patient about their current use of medicines. If they have any problems, we might advise them on their inhaler technique or administration of eye drops or any special requirements that they might have. During the medicines reconciliation, we may identify discrepancies which we'll communicate with the doctors just to be sure that we've got the patient's information current and up to date. We'll also help with the preparation of discharge medicines and we'll order a supply of medicines for the patient while they're in hospital. We do that electronically by handheld devices which connects with the dispensing systems down here in the dispensary. We also have a team of pharmacists, technicians and assistants who work behind the scenes down here in dispensary. Assistants will prepare stock for the wards. They'll keep all that stock replenished and ready for use on the wards to reduce missed doses. We've also got a procurement team. They manage all the stock for the whole trust, being sure that everything's readily available.
Hello, I'm Jane Starr. I'm the Medication Safety Officer at the Trust. I work across site and the main part of my job is that I'm looking at medication incidents and looking to see how we can either reduce them or learn from them to prevent maybe more serious incidents in the future. There's a lot of safety things around medicines, some are safer than others, but a lot of them we need to be really careful about using them, and we have policies and guidelines for those to make sure that they are safe. We respond to alerts, national alerts and local alerts as well, and if we see a lot of incidents coming up in a certain area or a certain type of drug, then we will act on those to put actions in. At the moment we've got a paper drug chart, although we are working towards getting electronic prescribing. The paper drug chart is buff in colour, kind of a creamy colour, and it's like a booklet style. There's different pages for regular, when required, once only medicines. We've also got a separate page for insulin and also those drugs which maybe need to be monitored and the dose changed fairly regularly, like warfarin, gentamicin. Pharmacy team normally write in green, so you can see our writing is different to the doctors or nurses. And also we've got a page on the front of the drug chart where if we find anything that we need you to make note of or understand, then we can put that on the front and it's not like a post-it note that'll fall off or something. In the shadow week, in your first week, we do prescribing assessments during that week. It's a written exam based on 6 kind of drug charts and patients. That's after the multiple choice one that you do. It's not too tricky or horrible, and we do give feedback on the day as a general feedback to show you what information is needed. We also can give feedback afterwards, or it can come from your tutors. And then as a result of that, there's the script modules that you can access online to do further training and assessments. We ask that you do 6 modules during your stay with us, but you can do as many as you like. And if you need advice on which ones to pick, according to maybe what your trainee needs are, we're happy to advise on that as well. If you're concerned about any incidents with medicines, you can report it to someone in the pharmacy staff or myself, or you can report it via Datex, which is our incident reporting database, which is quite easy. It's online on the Trust website.